Welcome to this short video on personality disorder. This is the fourth video in the series, and this is a resource for healthcare professionals. In the last session, I briefly mentioned the term validation. In this session, we're going to build on that and learn why it is important to offer validation to someone with emotionally unstable personality disorder who's in distress. I'm Dr. Krisha Patel, and I'm the mental health lead for the company. What is validation? If you watched the last webinar, I'd like you to pause the video now and write down a few bullet points on what you remember about validation. So validation is acknowledging the legitimacy of the internal experience and distress. It does not imply approval. It's acknowledging the thought, the feeling, or the behaviour as something that is legitimate and understandable in the current context and in the context of the person's previous experience. One of the most important things you can do when the patient with personality disorder is in distress is to offer validation. It's a key strategy in the treatment of emotionally unstable personality disorder, and it can and should be offered in all interactions with the patient. So even when I have the most hostile, angry, shouting and distressed patient in front of me who has personality disorder, I often find that just staying calm, being professional, listening to them and being non-judgmental, and then offering that validation can help just break down that barrier between us, and it helps to build the rapport and get the patient to be just a little bit more cooperative. It can de-escalate a situation and it can prevent it from escalating further. Don't underestimate the importance of validation in these situations. Always bear in mind that many of the patients with emotionally unstable personality disorder and other personality disorders will have experienced rejection, abuse, trauma, and stigma associated with the self-harm and with the diagnosis of having EUPD as well. Most of us healthcare practitioners have fortunately never had to experience things like rejection, abuse and trauma in our lives to the extent that many people with emotionally unstable personality disorder have. And that means we can't really understand the lived experience of the patient in front of us because we haven't lived their life and we haven't been in their shoes. So it's important to just be as non-judgmental as possible. So even if, as the healthcare practitioner, you don't understand the reasons why the patient in front of you has taken an overdose after a friend has cancelled on them, and even if you think that just seems like a total absurd overreaction to the situation, you don't know what the patient has been through in their life or in their childhood. In the setting we work in, where we have sort of fleeting interactions with patients, so for example, in the police station, patients will come in, we assess them, they're then released and we never see them again. It's not the right setting to start to explore these things about their past personal history of trauma. However, there are some patients, of course, who, and it's happened to me several times, where the patient will spontaneously just start to talk about their past history of abuse or neglect. And in these cases, I acknowledge it and I'll say something like, I don't understand what it's like growing up for you, but I can see life must have been very difficult. And perhaps this could be related to some of your difficulties now. So something along the lines of that. Be self-aware. Your reactions and your responses have a huge impact on the patient in front of you. The patient in front of you needs care and support. Their emotional and psychological pain is real. The way you respond to someone can either inflame or ameliorate the situation, hopefully the latter. In the last video, we talked about how patients with EUPD can make healthcare practitioners feel very anxious and evoke very strong emotions in professionals and others. And the patient can often pick up on this. They can pick up on your anxiety or your frustrations. So be aware of projecting that anxiety onto the patient. So if as the healthcare practitioner, you really are rushed off your feet and you really feel like you just are too busy to deal with this right now, the patient in front of you can often pick up on that. And to them, that can be something that's incredibly invalidating. To that patient, that might feel like you are just another professional who doesn't care. And that feels like invalidation, which is a concept that is like the opposite of validation. So if validation, as we mentioned already, is when you acknowledge the patient's distress as being legitimate in the current context and in the context of their past experience, invalidation is the opposite. Invalidation is when the patient's experiences are dismissed, they're discounted as something insignificant, they're discounted as something not real. So saying something like, your pain is not real, it's just psychological. Or they're discounted as someone who's not worthy of the professional's time. And many patients with EUPD will have experienced this invalidation their whole lives. And that includes the relentless self-invalidation that they do to themselves, such as when they tell themselves they're worthless and when they tell themselves they shouldn't be doing this or shouldn't be feeling like this. But it's also done by those around them, by their friends, their family, staff, professionals, and that self-invalidation and the invalidation from others around them frequently serves to maintain the disorder. Validation involves active listening. So if the person is distressed, the best thing you can do is listen and validate the distress. By listening and by helping them to process some of the distress, you can help to make it easier for the patient to digest. It also involves accurately reflecting back the patient's emotions, thoughts, and behaviours. So one useful tip is to let the patient speak, actively listen to what the patient is saying, and just jot down a few things, a few key points. Then reflect it back to them as a summary by saying something like, just so I can make sure I've understood what you've said, X happened and then that made you feel angry and this brought back some similar negative experiences you've had. So that's reflecting back to the patient. And then check with the patient that you have understood properly. So you can say something like, have I got that right? Have I understood that right? That way, the patient can feel like you've really listened to what they're saying and understood why they feel distressed. So validation, you can say things like, I can see you're in distress. Can you tell me what's going on? And rather than saying, I understand what you're going through, try saying something like, I don't know what it's like to be you, but it seems like life is really hard at the moment. I would like to understand what's going on for you. Can you tell me? And it's about exploring how they felt about the self-harm or the crisis before and how they feel about it now. Validation can help to counter previous invalidating experiences. So try to provide validation in all interactions. Invalidation. I've already touched on the concept of invalidation in the previous slide. It's a related concept whereby a person's internal experiences and behaviour are discounted or dismissed as not being legitimate. So it's things like having the person's opinion dismissed as stupid. And it's when the patient hears a professional say something like, oh, they're just playing up. They're just attention seeking. And many clients with personality disorder will have experienced a lot of invalidation in their lives and be extremely sensitive to this. So validation can be weakened by prematurely focusing on problem solving, minimizing the problem, or minimizing the overdose, or minimizing the self-harm, focusing too quickly on the positives, focusing on the self-harm only and the risk assessment, So it's important to recognise that unhelpful behaviours or self-destructive behaviours like self-harm, perhaps substance misuse, may be the only way the patient has had to cope with their experiences. So you can acknowledge that, offering inappropriate reassurances, unreasonable expectations, and interpreting all problems as stemming from the personality disorder. Remember, patients with personality disorder can have comorbid depression, substance misuse, and other mental health problems. So validation is a key strategy. So anytime someone with emotionally unstable personality disorder is in distress, offer some validation in all interactions. It really does help. In the next session, we're going to learn about other long-term general treatment principles in patients with EUPD. Thank you for listening, and if you found this video helpful, please like and subscribe and check out the other resources on my channel.